Thanks for joining me today. Really do appreciate it. So, first, just tell me if you can hear me fine, and also just tell me where you're chiming in from, and what were you doing? What did I take you away from doing because of this workshop? And there is a little bit of a delay from when I talk to when you see it, or when my sound and stuff reaches you. And so I just want you to know that. And I also want to make sure that you actually can see me and hear me fine. And I'm not the most tech savvy person, and I'm honestly not so sure where to get that confirmation from. Let's see, just a tad bit embarrassing. But I thought there was a chat box somewhere, but I somehow do not see it. Because I do see that there are viewers. There are 35 of you online. So I hope it is working. Okay. All right. So you can view this on the event page. You can also go to YouTube and view it. And either way, it should be working fine. So just wanted to tell you that. And just in case you don't know who I am Dr. Alyssa Marshall. I have been working with international dentists like yourself for several years now. I myself am an international dentist. I graduated from Korea first, and then I studied at UCLA. And yeah, so it's me and my team that's behind International Dentist Central. And welcome, welcome. All right. So we have a lot to cover today. This is a gigantic topic. So I hope you're ready to take notes. If you're not, pull out a notepad or something. There's going to be a lot of nuggets inside here that you would wish you had taken notes of. So yep, go pull out a notepad. And there is a Q&A thing that should work. On the event page, if you ask a question, it is supposed to show up where I'm talking. So if you have a question, plug in your question there, and we'll try our best to get to it. And but because I'm really not very good at multitasking, the questions I'll get to them at the very end. And during the presentation, I will not be looking at it because I can't do two things at one time. Okay, so let's get started. Patient positioning and indirect vision. Gigantic topic again, as I say, but welcome. Oh, that's right. This is a little bit again of who I am, and let's jump in. I'm not sure if you guys were at the workshop that we had 2 weeks ago. I used this image there as well, but if you remember this, that is somebody climbing up the stairs and somebody keep drawing the chalkboard. And it's not, I just want you to kind of keep this thing in mind. Like, you're not really going to get to a place where you're like, all right, I'm perfect. My skills are perfect. No, there's always like a continuous, your skill levels are always on a continuum. So I just put this image inside here one more time to give you a little fresh reminder of it. Also, because I like stairs, kind of a metaphor for me in terms of teaching bench test skills, because your skills in your bench test don't get better like a slope. It gets better like stair steps. So you will have a period of time where nothing feels like it's going anywhere, and then you stick to it, you keep practicing, and suddenly your skills will like progress, and then it will be steady for a while, and then it will progress. But if you stop because you're being steady, then nothing will happen. And So it requires a lot of patience, I guess that's what I really want to say. So stick to it and just keep this image in mind. And I've seen so many transformations. I have no doubt that every single one of you can transform. Okay, so patient positioning and indirect vision. First, let's talk about operator positioning. This is called a neutral position. Now, if you see this, this is like the classic good posture, right? Like your thighs are parallel to the floor, your feet are flat on the ground with the heels all the way touching, and your elbows are bent at 90 degrees. This is like the neutral position, and this is kind of where you want to start from when you are practicing. These days, I will tell you that there have been a lot of advances in dental operating chairs, and so there are a lot of chairs that support forward tilt and stuff like that. So if you look up like operator positioning for dentistry, you'll see a lot of different things and slightly different opinions. And personally, I do like the forward tilt, but that only is possible when you have a special chair that supports it, right? If you do have a forward tilt chair, then you can have your spine to your thighs at more of a 110-degree angle, but you can do that without leaning forward or anything because your chair itself will be tilting forward, if that makes sense. If you don't have anything like that, you're practicing at home, whatever, neutral position is what you're looking for. And please make sure your heels are all the way on the ground. And I know this is not like a sexy topic right now, but most of you are coming back to practice after having taken a long time off. And when you come back, don't pick up bad habits. Like, honestly, yes, you're practicing for the bench test, but this is like your lifelong profession. Don't take it lightly. This, like, bad habits you pick up now, like, it will stay with you. So take this seriously, and your posture and stuff like that. It is important, and it's going to stay with you. So neutral position, let's dive into it a little bit more. Neck. You want to be upright with your neck or up to like a little bit of a bend forward. 15 degrees is what it says. Anything over that, don't do it. It's not good for you. It really isn't. If you want to practice dentistry for a while, that is. Forward tilting of your whole body, hinging at your waist. Okay to do a little bit of it, avoid doing a lot of it, which is why we have to use indirect vision for some surfaces. There's like just no way around it. There's no way around seeing those surfaces without, if you don't use indirect vision, then you have to compromise your posture to get there, right? And we don't want that. Shoulders, this is a big one. This is really, really a big one. I mean, like if you see somebody's posture, or if it was a multiple choice question and I said, okay, should your shoulders be down or up? Everybody's going to say down. But in reality, so many people have their shoulders like crunched up, kind of like headed towards their ears while they practice. And this is going to really make your life miserable. And this is from, I'm talking from experience here, because when I practiced for the bench test and I was not paying much attention to this kind of stuff. There was a few days that I literally cried because my body ached so bad I couldn't practice anymore, and I felt like I had to keep going. Anyway, so yeah, this is a big one. And nobody was telling me at that time to relax your shoulders. And by shoulders, it was so bad I couldn't turn my neck from side to side. It became that bad. It is more difficult when you're practicing at home because you don't have those ergonomic dental chairs and stuff like that, but it can be done. Your arms, you want to have it either at your body or lift it a little bit, but not a lot. If you lift it a lot, your shoulders tend to go up with it. I do like lifting it a little bit versus keeping it too close to your body, depending on what you're doing. But I see that advising to lift up your elbows a little bit oftentimes stabilizes hands, even though it looks counterintuitive, because in a way the elbow can act like kind of like another rest, but it really decreases your ability to make certain movements and reach certain places. That becomes a lot more flexible when you lift up your arm just a little bit. Your forearms, you want to have it slightly down to slightly up, not too much. This said 60 degrees. Honestly, I think 60 degrees is a lot to be lifting up your hands at. You want it at 90 degrees if you can. And then your hands, your wrists, like you want to keep your neutral wrist position as well. Okay, so patient positioning. When we position patients, you've got to know the difference between the chair tilt and the chair height. And this is another one of those things that, I mean, everybody's so smart. If it's like, if you see a picture of it, you know exactly what I'm talking about. But when they're practicing, they make this mistake. Somehow the knowledge you know doesn't always connect to the practice you're doing. So I've got to highlight this. Chair tilt is what you see on the left-hand side, and chair height is what you see on the right-hand side, right? Tilting back and up and down. Then, which one of those is adjustable here? Is it the height or is it the tilt? This is like the classic model most people use for their home practice, right? The most basic mounting pole. There's absolutely nothing wrong with it, but only one of them adjusts here, and that's the tilt. If you want to adjust the height, you have to change the entire mounting setting. The mount where it's like mounted right now on what you see as a desk, that needs to be mounted on a lower desk to adjust the height without adjusting the tilt. So keep that in mind. A lot of people will just be like, okay, I need to lower it, and they lower the tilt, right? And you may be like, well, that means that I need a different mounting surface. And yes, that is correct. You should not be mounting it on a desk kind of surface. And I brought in this picture. This is actually an awful picture, but I brought in this picture to show you, and it's the side. You see like how you can mount it on the side. It's right now it's mounted on the top of the chair, but this person could have mounted this on the side of the chair. And if it is mounted on the side or on a table leg instead of the desk part, then all you need to do is unscrew it just a little bit and loosen it up, and then move it up and down to adjust the height. And you always want to make sure that you're working on your setup at home is in such so that you can adjust the height as well as the tilt. The tilt is always going to be adjustable with the Typodont mounting pole itself, but the height, you must be able to adjust it. Okay, if you don't, you're doing something wrong, or you're extremely badly compromising your posture. It's one or the other. There's no in between really with it. Okay, so when you are adjusting things, you want to adjust the tilt first. So what you see here are 4 degrees of tilt: upright, semi-supine, supine, and Trendelenburg. So upright, honestly, nobody's going to try to treat a patient like this unless you're taking an impression or something like that. We're not talking about that kind of stuff. We're really focusing on just the bench test. Semi-supine is where you kind of want to be for the lower arch prep. Supine is where you want to be for the upper arch prep, and don't do Trendelenburg. I know this sounds so obvious when I talk it, but it is actually confusing when you have a mounting pole because there's no human attached to it. Like, you don't see it, right? But this does support the Trendelenburg posture. The mounting pole allows you to recline it all the way down, like for however way you want. So with this mounting pole, it is possible to go like hang the patient upside down, right? So you have to be mindful of not letting the mounting pole angle down too far. So the maximum you can go, always be looking at your upper arch. The upper arch can be vertical to the floor, and that's it. That's approximately where the mounting pole itself is parallel to the floor, or even a little bit less than that, just a tad. But if you go any more than that, then you're at Trendelenburg. So keep that in mind and do not do that. After you adjust the tilt, so when you approach like your practice, you're gonna know what you're going to do, or like what prep you're going to do, right? After you figure that out, you first have to adjust the height of the tilt. Okay, so if you're lower, you're going to have it at about 30 to 45 degrees at a semi-supine. If it's upper, you're going to lie the patient all the way down. After you do that, now you work on the height. And the height is, we put the tooth we're working on, you want it at the level where the shoulders are neutral and the forearms are neutral. So what you're seeing here, like the 90-degree angle, the extension of the fingers, that is exactly where you want the operating tooth itself to be. Okay, shoulders down. Make sure that when you're like sitting before you start, you don't that you're very, very close to ideal, that you don't have to lift your arms too much up or down to start. And that's how you adjust the height. And here's a picture of somebody obviously operating with awful posture. Forearms are tilted up too much. And I see this very often, so I included it here. It's very easy to spot mistakes from pictures or even other people's practices, but it's difficult to self-evaluate. So maybe even ask somebody that lives with you, if you have anybody, to take a picture of you randomly while you practice without telling you, and take a look at that picture. You'll probably be shocked at how you practice. Okay, so height second. Then after we get the tilt and the height, we can talk about operating seating positions. Operator seating. So approximately 7 o'clock position to 12 o'clock position, and we're talking for the right-handed operator here. If you're left-handed, just flip everything right to left. But for the right-handed operator, the position is 7 o'clock to 12 o'clock. That's like your zone of where you can go back and forth, and you want to use that zone. You really, really do. Now, depending on which surface or which tooth you're working on, you're going to be working on a different zone. Upper is so much more straightforward for the most part. And honestly, as long as you stay within the operator zone, there's no wrong there. It's not like the neutral position or the shoulder hunching, where that's like, that just is kind of just plain wrong, and like you're doing this in a way where it's gonna be bad for you. The height is also something that there's like a clear right and a wrong, but the zone of operation is something that there isn't that, because it's your zone. You can sit wherever you need to approach wherever you're trying to the best. So keep that in mind before being like, all right, this is correct, this is incorrect. I'm just going to give you guidelines here and where I recommend people to start practicing from, but I do want you to know that that is not absolutely necessary to stay there. So upper arch. Most of the time, you're going to stay within the 11 to 12 o'clock position while you work on the upper. And the patient is supine. So the patient's obviously chair is going to be a lot higher location-wise than if you would have if the patient would be at a semi-supine position, right? So the patient is lying all the way down, the chair is brought up fairly high. If you look at this operator here, this doctor is not at a totally neutral position, because the chair he's using supports the forward tilt. So that's why you see this non-neutral position, but he's still at a very good posture. So that is that. Okay, so upper, you're going to stay at approximately 11 to 12 o'clock, but you're going to turn the mannequin head right to left liberally. I see this not happening so often. This is the equivalent of, this is different from going Trendelenburg, right? If you go Trendelenburg, you're like starting to hang the patient upside down. But turning the head right to left is a very physiological movement. Like these positions are all based off of what's comfortable for the patient, what's good for you, and meeting in that neutral or that middle zone is where we're at, right? Or we usually want to keep the patient as comfortable as possible, but anyhow. So, but there's nothing wrong with turning the mannequin head right to left a lot, because all that is the patient turning the head right to left, and that's totally comfortable. That's totally fine. Um, and you may explore coming a little bit more to the 10 o'clock or the 9 o'clock-esque position when you're working on crown preps, the buccal or lingual surfaces. For the occlusal surfaces of the upper, usually you just want to stay at 11 to 12 o'clock, but buccal or lingual, sometimes like give yourself room if you feel like you want to just try for a little bit from the side, because that is completely fine. Lower arch, you have a lot more options, a lot more freedom in terms of where to sit. And this only shows 9 o'clock to 7 o'clock. That's not 6 o'clock. 9 o'clock to 7 o'clock operator positioned, but you can also sit at 11 o'clock as well. And a lot of operators do actually choose to they stay at 11 o'clock for everything. And there's nothing wrong with that either. But here's where I recommend you start with when you're working on the lower arch. The right side can be a little bit different from the left side. Not by much, but a little bit. So when you're working on the patient's right side, you want it approximately 45 degrees reclined, and you want to be a little bit more forward. So 7 to 9 o'clock position will give you really good view of stuff. When you're working on the left-hand side, sometimes or oftentimes operators find it a little bit more comfortable to lean the patient back 10 to 15 degrees more than they did when they worked on the right-hand side. This is something that you should explore yourself, in all honesty, because operators do operate differently, and that is really, really totally fine. But start here and try. But whichever right or left side or wherever you're working on, the mannequin head turned just a little bit to the right increases the visibility drastically. So just turn it a little bit. And it's because like you're at the right hand side of the patient, so like that little opening, it's like a world of a difference. And the reason I want to introduce you to positions other than 11 o'clock, however, is because a lot of people that operate only from 11 o'clock do so out of habit, because they've never tried anything other than 11 o'clock. So if that's you, if you've never, if like you just by default always sat and operated at 11 o'clock position, you should totally try 9 o'clock to 7 o'clock-esque positions while you practice and just see whether you like it or not. You might be surprised, and I like it a lot. So yeah, give that a try. Okay, now let's talk about indirect vision. Indirect vision is it's operating through a mirror, right? And a very small mirror at that. So when we blow up a mirror big, it looks pretty big, but in reality, what it looks like is this tiny little mirror flashing at a tooth, and it's not easy. It's like, well, you just want to see it. Like it can feel very frustrating to try to see everything through that tiny surface, when if you just bend over a little bit, you can see everything. You can see the entire mouth in one whole view. So when do we need it? When do we really need it? This is the times where we like absolutely need indirect vision. upper posterior occlusal surface, upper anterior palatal surface, and lower anterior lingual surface. Now, we don't really work with lower anteriors here, so just scratch that out of your mind. So it's upper posterior occlusal and upper anterior palatal. Note that upper posterior buccal and lingual surfaces are approached under direct vision, not with indirect vision. You can see it, right? Just have the patient turn the head to the right and the left, and depending on which direction it's at, you will see the buccal or the lingual surfaces of, the tooth. So only use indirect vision when it is absolutely necessary. Direct vision is going to give you better results, and it will beat indirect vision. It will beat your work under indirect vision every single time. No exceptions, seriously. So before jumping into being like, oh my God, I have to do my entire upper indirect, no, that's not true at all. You're going to see if you can maintain your posture and the patient's posture, and somehow you tilt the patient's head, do stuff like that, and somehow see if there is a view where you can see or approach where you're trying to approach with direct vision first. And you're only going to jump to indirect when the answer to that is a very clear no, if that doesn't work. Okay, so I want to make that very, 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 very clear first. Okay, so training for indirect vision. This is such a cool device, and I'm actually not really telling you to buy it because it's like pretty expensive, and I actually I was looking, I couldn't find a place that sold it in the US. There's some German guy that came up with this device for training for indirect vision, but it is genius. It's called Miro Prep, Mirro Prep. It was about 210 euros. So if you translate it into dollars, it's gonna be like 250 bucks. But anyway, what this guy intended to do was this. You put this plate in front so that you can't see the paper directly. You can only see the paper through the mirror that's in the back. You hold a pencil through something that looks a simulated handpiece kind of thing, and you trace whatever is there, or you fill in the blanks, or like you color inside shapes and stuff like that. I say make your own version of this at home. Stand up a mirror, put just something in front of you to block the view. A book would work. Draw lines for you to follow at home. Just hold a pencil and try following the lines and stuff like that. This is going to help you so much. I can't tell you how much it will help you, because indirect vision, you're operating from mirror view. What you think is right is actually left. What you think is front is actually back. And so what happens is we're trying to go from, let's say, distal to lingual, but we actually end up going distal lingual to the mesial is what we want to do, right? But we end up going distal lingual to the distal tooth, and we nick the adjacent tooth, even though we thought we were where we intended to bring the prep mesially. We end up going the opposite direction, right? And that's because we're not used to working out of mirrors. Like, that's just not how our brains work. So this is, that training device. And this is a picture that I grabbed from a published study from the company that made that device. And it's actually not one person's improvement, but it is actually a first-year dental student versus a third-year or fourth-year dental student. They asked them to do it. But you can see how, like, the first-year dental student is like wobbly. It went out of the lines. All these red arrows are the errors what the first-year dental student made. And you can see there's a lot of them, versus the third-year dental student much more calmly was able to trace through. So this, even though this is not a showing like, oh, one person practiced for this long and like got this much better. It is showing the difference it can potentially make um, in you. So this is, yeah. Anyway, so after you train your hand like that, and according to that published study, they say that participants seem to retain the practice they did for a long time. So it's going to stay with you. And then if you combine that with, you know, doing preps and stuff like that, it really is going to stay with you. And guess what? It's going to stay with you for your profession, not just for your bench test. So isn't that exciting to be able to be that dentist that always is at that cool, relaxed back, leaned back posture rather than the dentist that is hunched over the patient's mouth all the time? I think that is a great time investment, not just for the bench test, but for you. So just draw something similar, trace lines, and fill in shapes, just like it shows. And filling in shapes is going to help you for things like, let's say, it's simulating things more like widening cavities and stuff like that, versus tracing lines is obviously helping you in all directions, like which way to turn, you know, which direction is which direction, stuff like that. Yeah, so just draw something, make something at home that's comparable to that, and get to work. Tips though for it, obviously finger rest. You need a real finger rest, not just like a pretend finger rest. And by that I mean fourth finger is there, and it is also um, it also has a lot of force on it. It's actually acting as a stabilizer. And you will hear me say this if you've been watching our workshops and stuff like that for a while. You probably heard me say this like 10 times by now. I will say it again because it is one of the most important things. It really, 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 really is. Have a real finger rest. And then slow down. Please slow down. This I say because there's no rush. There really isn't. And I'll put it this way. If you're not 1000% sure that what you're doing right now with your burr is what you want it to be, then it is time to stop and watch. Let me say that again. If you're not completely sure that your burr is doing what you want it to do, then stop and observe and watch first, okay? I say this because so often I actually stopped people working and said, are you sure you're doing what you want to do? And they just like, no. I'm like, well, why are you keep prepping? They're like, I don't know. So like, are you prepping out of like hoping that if your burr is somewhere around where you want to prep, like magically the prep you want to do will appear? I tell you that will never happen, like ever. So please don't do that. And there's no rush really. And especially with when you're doing indirect vision stuff, always do practice strokes before running the handpiece. So bring your handpiece to where you want to work, right? Don't press the foot pedal yet. Look into the mirror, take a deep breath, and like if there's that little corner you want to get rid of or that little rough spot, practice going over that spot with a dead handpiece. Why not, right? And see if how you think you should move is actually how it should move, because you'll see it right away in the mirror. If you're going mesially when you thought you'd be going distally, you will see that with the dead handpiece. So do that every single time before running a handpiece. It's actually a really good practice even for direct vision for certain things, really, because it really controls, it helps, it kind of gives you muscle memory, so it lets you get right into the flow right away instead of maybe coming like putting too much force on something, like unintentionally or stuff like that. So it's always a good idea. Practice strokes before running the handpiece. And last tip, use loops. Our tendency is to want to hunch over because we can't see, right? Well, that's what loops are for. They magnify things for you. You don't have to bend over to see better. It will magnify you. So it comes in lots of magnifications, and it may not be as satisfying as like leaning over. It probably won't be for a long time until you get really used to them and like become one with your loops. But it will be a lot better than trying to see stuff with your naked eye. So use loops if you have time to do it. I don't recommend it if you have less than 2 to 3 months to practice. Right now is a good time to pick it up. And by the way, guys, now there is on the presentation page, there on the right-hand side, you'll see a link that you can click to submit questions. So please go over there and send in questions if you have any at all. Yeah, so it's just called workshop questions. So yeah, just go over there, click it, and send in your questions. Okay, so use loops was my last tip in regards to that. And let me find my presentation. Okay, here it is. So loops, this is just a few quick words about them. There are two types in large. What you see on the left-hand side, if you look at them, the magnifying glass part is attached to the glasses, right? Versus the right-hand side, it isn't. The right-hand side is what you're looking for right now. The left-hand side, it's called through the lens or TTL. The right-hand side model is called flip-ups. Both are fine, except that to get TTLs, you need them custom made for you, versus flip-ups are adjustable, okay? So make sure, like, don't even think about TTL. Honestly, like, it's totally fine. It's going to be more than sufficient on what you need. You just have to adjust them to your eyes. So you're looking for flip-ups. It is totally worth it. Some people take a very long time to get used to them. And like, if you're the type of person that gets seasick or like motion sickness, it'll be more difficult for you. And I was one of those people actually too. And it took me a long time. I hated it in the beginning. I was like, I just couldn't use it. Stick with it. Like, just use it for like a minute or two first, and then like in a few days use it for like 5 minutes a day. So don't even try to use it for your entire prep. Just use it for a few minutes and then increase that time, and I promise it will totally be worth your time. I recommend starting from 2.5 magnification just because it is much easier to get used to. And I mean, magnifying something 2.5 times is so much more better than seeing it at 1x, right? So it's pretty awesome. Optional, but I do recommend getting loop lights. Those are little attachable lights that attach right onto the glasses, and they will make a world of a difference for you. And honestly, these days you can get them for pretty cheap on like an eBay. And loops too, like for the purpose of going through the bench test, I do recommend just get, these are your first pair of loops. You don't know what your preference will be. You don't know what magnification you'll end up wanting to keep on using when you practice. Just pick up a cheap pair from eBay. You can get something for like you can get loops and a light for less than $100. And it's like your starter pair, your training wheels, and it's more than enough to get you through your bench test. So just do that. And if you do end up wanting to, or switching from a 2.5 to a 3.5 because you're now used to it and you feel like you can go up or whatever, you need lights. This is for your eyes. You really, really, really need lights. Even for 2.5, I do recommend using lights, and always make sure your lighting is pretty good wherever you're practicing. Get like spotlights. You can get $10 lights from IKEA that is very spot focused. Those are excellent. Um, and obviously very affordable. I recommend you get 2 of those so that you can shine lights from 2 different directions, so that if your hand covers one, you're still getting light from another one. And yeah, that is the deal with loops. And you guys, that is all I've got for you for that. If you have any questions, put that inside that the right hand side. There's a link to submit your questions. Put them there, and it seems like there's nothing that came in yet. I will be around here and answering them if there is any, so it probably is actually a pretty good time to submit them, because last time there were too many to answer. Anyhow, if you love our workshops, and I hope you got a lot of value out of today's workshop, we went through patient positioning, starting from operator positioning, patient positioning, the tilt, the height, all of those kind of things, and then indirect vision, when to use it, how to train for it, and other tips in regards to indirect vision. Indirect vision is one of those areas that even in US dental schools, it is not quite taught very well. So training for this on your own is it's gonna benefit you like greatly. Anyway, so that's that, and I've got awesome news for you, and that is that now we have something called an all access pass for the workshops. The workshops, obviously, when they're live, they're open to the public, they're free, and you should totally come. But what if you either can't make it, you want to watch the past ones, or you just want to watch it again? Well, now you can. If you go to internationaldentistcentral.com/workshops, that is where you can join the All Access Pass. And if you are a bench test or interview mastery member, it is already included for you. You will have access to everything, so you don't need to go. But if you're not either a bench test or an interview mastery member, go to internationaldentistcentral.com/workshops to get the All Access Pass. That is, you have 2 options of getting it. You can either be on a monthly plan for $29 a month, and you can cancel anytime, obviously, and you'll just have access to everything while you are a member. Or if you want to just stay a member and have access to all of our past ones and all of our upcoming ones, and just have all of that until you're done with everything, then you can just pay a $199 one-time fee and you'll have access to everything. Or you can just join the bench test or interview mastery course as well. Then you will have access to both the both whatever course you're signing up for, plus all of the workshops until you need them. So now I put up that link on the right-hand side as well. So if you want that, just click that to go straight to information page regarding the All Access Pass. Super excited because we got so many emails from people saying that they just can't make the workshop live. So we're like, well, let's do it. So we made this this level for you, and I hope you guys enjoy it very much. And by the way, with that All Access Pass, you will also have access to our member-only Facebook group. So that is where members chat, and we get very technical about things, and you can ask me a lot of questions inside there as well. So just wanted to throw that in there, and I don't think we got any questions. I am very, very surprised. All right. Then I guess it is time to wrap up, and thank you for showing up and spending this time with me. It really does mean a lot to me, and I had a good time, so I hope you got a lot of this, you got a lot out of this as well, and have a fantastic rest of your day. And don't forget to show up next week. We will have our sorry, not our editor, but our interview coach on during our next week's workshop, and we will be talking about patterns she saw because she's been interviewing or working with candidates on their interview skills for 2 seasons now. So she's seen a lot and she does so many mock interviews every season. So by now, like when she starts talking to a candidate, she knows where they're at with their interview skills, and she has like a really good comparison point to the rest of the applicant pool. And so if you wonder what she thinks you should be working on, or what some big mistakes people commonly make, unknowingly, obviously, because everybody tries to do their best, common mistakes, stuff like that, be here for at the same time next week, Wednesday. And that's all I've got for you today. I will see you then and have a fantastic rest of your week.